Welcome to everyone, and we're very happy to have you all here today. We will be covering a number of very significant policy issues today, and we appreciate you being here to participate in these very important topics. We will be covering the Department of Child Support Services, state administrative hearings, child welfare services, CalFresh, and CalWorks. We will be having public comment after each agenda item. And like I said, we appreciate you all being here to comment. But we also would like to ask you to limit your testimony to 1 minute each, because we know we will have a lot of people today and we want to make sure we give everybody an opportunity to speak. So thank you very much for that. And we're going to go ahead and begin our agenda with the Department of Child Support Services and an overview. I want to welcome the director, Kathleen Hripik. Did I do that okay, Kathleen? And also Administrative Services Deputy Director, Linda Adams. And if anybody else is joining us, please introduce yourselves when it's your time to speak. And of course, we would like to hear the overview and then answers to any questions we have posed. Good morning. And if you push the red button, the microphone works. Yes, perfect.
Good morning, Senator Corbett and committee members. I am Kathleen Repich, the Interim Director of the California Department of Child Support Services, and I am joined by Linda Adams, our Deputy Director for Administrative Services. The Department of Child Support Services is designated as the single state entity responsible for ensuring that all functions necessary to establish, collect, and distribute child support are effectively and efficiently implemented. We have provided you with a handout which covers the program in detail, so I will just call out a few of the highlights for you. California's child support program is the second largest in the nation. Services are delivered through county child support agencies that serve almost 1.3 million children annually. Collections for last year totaled over $2.3 billion. All state child support programs are evaluated on 5 federal performance measures in which the state is awarded incentive dollars based on its performance. Compared against 2012, California improved in 4 of the 5 federal performance measures: cases with support orders established, collection on current support, cases with collections on arrears, and our statewide cost effectiveness for federal fiscal year 2013 is at an all-time high of $2.54, and this is an improvement of 7 cents over last year. On the 5th federal performance measure, statewide paternity, our performance for this federal measure has dipped a bit, and we were at 101.6% in 2012, and now we are at 98.6% for 2013. However, we received the maximum federal incentive dollars for this performance measure, and thus there is no impact on our funding. The department is currently analyzing what factors contributed to the decrease so that we can address that. And at this point, I'm going to turn it over to Linda Adams to provide more detail on our budget.
Thank you.
Good morning, Linda Adams, the Deputy Director of Administrative Services, and I'll be talking about the financial side of child support that's in the handout that we gave you to. The DCSS overall total budget is just under $1 billion, with 77% of those funds going to local child support agencies in support of the program. The program is funded 66% federal dollars and 34% our state general fund. The general fund for the department is around $313 million and has stayed relatively level over the past 4 years. The child support enforcement automation system budget has declined over the last 4 years, reflecting the shift from development to maintenance and operations. And the state disbursement unit has been reduced by almost a third, reflecting the savings resulting from a change to a new vendor in 2012. And on our child support collections, distributed collections over the last 4 years have increased by 2.6%. We've seen a decrease in the amount recouped to the general fund as our collections shift from assistance to non-assistance. In 2009, our assistance collections were 23% of the total distributed, and that amount has now gone down to 20%. We have a revenue stabilization premise item. These were additional funds. In 2009-10, the governor's budget proposed an augmentation of $18.7 million for local child support agencies to maintain revenue-generating caseworkers. Sorry.
Do you mind referencing the page numbers in the handout?
I'm sorry. I don't think there is a revenue stabilization page in there.
Okay.
The other pages I were talking about are on page 17, 18, and 19 for the funding,
okay,
and 23 for the collections.
Okay, thank you.
Okay. So for revenue stabilization, the legislature approved the request for funding in the 2009 Budget Act and directed that 100% of the new funds be used to maintain revenue-generating caseworker staffing levels. Collection data for 2012-13 indicates the revenue stabilization funds continue to have a positive impact on maintaining statewide child support collection levels. In 2012-13, LCSAs were able to retain 234 of the originally retained 245 revenue-generating staff with the revenue stabilization funding. For the $6.4 million general fund investment, DCSS retained $8 million in general fund assistance collections in 12-13, yielding a net return of $1.6 million general fund. In addition, the LCSA's early intervention strategies, which were required as a condition of the funding, continue to increase the engagement of parents in their child support cases and positively influence payment behavior. There is a revenue stabilization report that's longer that's out on our webpage that was done in January 2014. Are you ready to move to the BCP?
Yeah, I'm just thinking if I have a question just real quick.
Okay.
All right, go ahead, please.
Okay, so the department has submitted a BCP number 1. We're requesting a shift in funding from local assistance to state operations in the amount of $11.95 million or $4.606 million general fund, and position authority for 100 full-time permanent positions to replace 100 contract staff over a 3-year period of time beginning in state fiscal year 2014-15 to continue the maintenance and operations of the federally mandated child support enforcement system known as CSE. The transition will result in an ongoing reduction of $699,000 or $237,000 general fund in total project funding and ongoing net budgetary savings. CSE is managed by the department. Responsibility for managing and delivering services was transferred from IBM, our business partner, to the state in 2009. To fulfill this responsibility, the department must have in place all the resources required to continue the CSE system operations without impact to system reliability, availability, and performance. Currently, under the supervision of state staff, maintenance and operations services are provided by a combination of state and contract staff. Funding for maintenance and operation of the system through a contract was approved in the fiscal year 2010 budget process through DCSS BCP number 1 and a subsequent spring finance letter number 21. The contract services began on May 1st, 2011. Given the scope and character of the workload as well as the complexity of CSE, DCSS had always planned to replace contract resources with state staff to maintain the system. DCSS is proposing a phased-in replacement plan to ensure continued stability of the system, minimize the risk of making too many workforce changes at one time, and reduce the cost of maintaining and operating CSE. Approximately 100 contract staff support CSE. This proposal recommends transitioning contract staff to permanent state civil service positions over a 3-year period, as illustrated on page 4 of the narrative of the BCP. This effort will be accomplished by using the state recruitment and hiring process. The contract staff work in the most technical CSE system maintenance and operation positions, including application development, database administration, application testing, network services, application system, database architecture, production support, batch operations. The contract staff services will be terminated once the hiring process has been completed and the workload has been transitioned. Beginning in July 2014, transition of staff will occur in phases by function. For instance, of the 14 staff in application testing, 7 will be replaced in the first year, 6 the second year, and 1 in the third year. This process will be used across all the functions over the entire 3-year transaction. Once transition begins, the department will be continually evaluating performance to ensure the integrity of the system is not compromised.
So I have a question about the transition in the hiring. I heard what you said. Obviously, you will be hiring state staff to cover the contract positions.
That's correct.
And will there be, I'm assuming there'll have to be some training and some ramp up?
That's correct. So we'll recruit for the staff, bring them on board, and then there'll be an overlap with the contract staff as they do knowledge transfer and make sure that the state staff are not thoroughly knowledgeable before they...
That was exactly my question. How do you transfer the knowledge and the training from the contract staff to the state employees? It sounds like you have that planned. All right. Thank you very much.
Can I just
yes, please.
On that issue? I'm looking at page 6 of our agenda here. It looks like with that conversion of 100 contract positions to civil service positions, we save roughly $700,000 over
That's
3
correct.
years.
Yes.
Oh, well, at the end of 3 years, the savings per year will be $700,000
Per year.
Per year.
Per year.
Thank you.
We appreciate that. Thank you very much. All right. Department of Finance, any comments on either of those 2 items? Legislative analysts.
Thank you, Madam Chair. Ginny Bella with the Legislative Analyst's Office. We have no concerns to raise with this proposal as it reflects a planned transition from contract staff to state staff and results in some savings.
Great. Thank you very much. Public comment on either of those 2 items? All right. Seeing none, thank you very much for the report.
Thank you.
Thank you.
The first item was an informational item. The second item is a vote item. Senator Monning, what's your pleasure?
Is that hold open?
Oh, I'm so sorry. I
Holding
didn't.
that open.
Yeah, this is a hold open item, so we will hold that item open.
I move that we hold it open.
Yes, thank you. It does say vote right here, by the way. So that item will be held open. Thank you so much. The next item will be under the Department of Social Services, the State Hearings Division. We'd like to welcome Deputy Director of the State Hearings Director, Manuel Romero, and also the Director, Mr. Lightbourne, as well. Thank you for being here. We look forward to your answers to our questions.
Thank you, Chair Corbett, Senator Monning. I'm just going to introduce Chief Judge Manuel Romero of our State Hearings Division, who will explain the budget request and the need, given caseload growth largely from Medicaid expansion in the state.
Good morning.
Good morning.
Good morning, Madam Chair and Senator Monning. It's a pleasure to be here this morning. I do have a handout. May I approach? As I go through my presentation this morning, I'll bring particular attention to different pages here that I would ask you to focus on as I address the questions that have been presented. The first question is to please provide a summary of the proposal, including the justification and how the department will seek federal reimbursement for costs associated with the increased hearing request workload. I am going to begin my comments by a little bit of background in terms of where state hearings finds itself before engaging this new workload. And it's important, I think, for the committee to understand that because we've been here before. We were here last year and we requested and were approved for resources to help us to address the growing penalties that we were getting for late cases, and that allocation that we received last year, which was a total of 41 positions, 24 which were ALJs and 17 were administrative support staff, has made a tremendous difference in our ability to be able to address the backlog that we had and to begin that process of mitigating penalties. So as we enter into this with this request for resources to address the new workload that we have been asked to conduct and perform, I want to address your attention to the very last page of the handout. It's a clipping. There's a one-page handout. This chart here provides you the information as to how we're doing with the allocation that we received July 1. It tells you where we were prior to July 1, which we were at 48 ALJ capacity. With the additional resources that we received, that brought us to 70, and we have been able to utilize 64 of those ALJs now for direct line and conducting the hearings and issuing the decisions. And as you can see, we broke it down by CalWorks, CalFresh, IHSS, Medi-Cal, disability hearings. Harris is a new caseload that we received as a result of litigation that was settled last year, requiring the state to provide state-level due process or state-level hearings, and that workload came to us, and that was included in here as well. So with the additional resources, if you look at the bottom part of this, where we say, where we indicate that by maintaining all positions requested and that were authorized last year, we're able to have a plus side of 19, meaning that we could do 19 additional cases with the resources that were allocated. So going into this new workload, we are at a point where we feel confident that we will be able to address the existing workload, which we refer to as general jurisdiction, but in order to maintain that and in order to ensure that we do not, again, fall into a problem of increasing and penalties, it's important that when we do get a new workload that we address the need for resources, which that brings us to then the Affordable Care Act. The Affordable Care Act in our BCP specifically addresses what it will take for us to be able to maintain timeliness with that workload and also not impacting the workload that we currently are addressing with our existing allocation. If you look at page 7 of the handout, the colored one, this demonstrates for you the allocation of what our workload currently is, a pie chart on the left, and then what the allocation of what our workload will look like with the new workload. And as you can see, it's a substantial and significant increase of over 9,400 total appeals or hearings that would be required to conduct hearings and have decisions issued. And the numbers that we relied on in terms of our BCP were provided to us by Department of Healthcare Services and by Covered California. And it is estimated that 5.4 million Californians will become eligible for coverage under Covered California. Covered California has estimated that 630,000 applications will come in during 2014, 2015. And of these, they've estimated that about 24,000, a little bit over 20,000, will result in appeals. And from that, of that amount, about 25% or a little bit over 6,000 would require a hearing and a decision. With respect to the expanded Medicaid, which Department of Healthcare Services is responsible for, it is estimated that about 1.4 million newly eligible individuals will be covered. Of that, an estimated 551,000 almost 552,000 will be enrolled in 2014, which will result with an estimated 13,798 appeals, resulting in over 3,400 actual hearings. Now, the methodology for how we arrive at this, this is based upon our historical experience. We take the total number of anticipated hearing requests, and we take about 2.5% of that in terms of the hearing appeals that will actually be filed with state hearings. And of that, it's about 25% actually then go to hearing and require a decision to be issued. And that's how we are arriving at the need to have the requests that we've made for 63 positions for handling the workload, which breaks down approximately to 39 ALJs and the rest support staff. That is the, based on this cost would be approximately 9.8 million. 1.2 of that would be in general fund, and I'm answering in part the allocation. Given that this is affordable care, it's a 90-10, so the general fund piece of that will be 10%, and the federal component of that will be 90%, at least through 2018. So that's how the allocation for this BCP and how that would fall in terms of the funding. There's a second component to the BCP, in that it also requests funding for a new appeals case management appeal system. We have had in state hearings a system that's been around since 1977, and it has all the limitations and problems that you can imagine an old system like that can result in, when we're entering the 21st century. And we've outlined those in the BCP in terms of our problems that we have with it not only being inefficient and unable to, in a cost-effective way, allow us to conduct and meet our business needs, but it also poses security and language compliance issues for us. So there's the HIPAA concern that we have. It is not fully, this system that we currently exist under is not HIPAA compliant, and it certainly has not met the language requirements, because we can't generate notices in the various languages that we should be issuing those notices in. And moving towards a new system that allows us to have one integrated, unified system that brings all of our needs together and allows us to generate reports in a more timely manner, allows us to limit mistakes and errors in terms of avoiding multiple handling of information or multiple inputting of information, and allowing the ability for our stakeholders, including the counties, which is the largest entity that we work with, to be able to access that system will allow us to enter the 21st century into have the most effective state hearing process, and to the extent that not having a system in place contributes to penalties, a system will also help us mitigate penalties in the long term. And I think the second question I already addressed in terms of how we estimated, and that we believe that's the allocation that would allow us to be timely. Our general requirement for us to issue a decision after a hearing request has been filed is 90 days. So with the exception of CalFresh, those are 60 days. And we took that into account as we calculated the resource that will be needed for us to remain timely. If we don't get this resource, we definitely will not be able to meet timeliness, would have a backlog immediately, and it would definitely set us back immediately in terms of the progress that we've been able to make with the allocation that we received last year.
Well, we appreciate the fact that you've dealt with the backlog. And looking at the first chart that you gave us, I'm assuming that's the case that you're making here, that the backlog has been completely dealt with?
Well, let me clarify in terms of completely dealt with. If you look at page 9 of the handout, Again, this allows me to get a little bit into explaining the formula, the penalty formula. The penalty formula under the court orders that we're under is complex, but it reduced to its essence. It has two components to it. We have to meet 95% or better timeliness in each of those categories of programs: CalFresh, IHSS, Medi-Cal, and CalWorks.
Right.
So what happens with the formula, the second piece of the formula, is that for every month that we are untimely, the penalty goes up by $2.50. That $2.50 continues to climb if we aren't able to meet 95% or better for any one of those programs. And what that meant during the past 5 years when we were in the recession is that as workload increased and as our capacity diminished, and our capacity diminished for a number of reasons, not only because there was increased workload, but also because there was furloughs, hiring freeze, hiring freeze and retirements. So as retirements took place, we weren't able to replace those positions as a result of the hiring freeze. And as the furloughs took place, that meant 15% when we were having folks taking 2 to 3 days off per month. That meant that we lost 15% production. All of those factors almost created a perfect storm to where then we just didn't have the capacity to keep up with the growing workload. The penalties grew for all categories during that time, and for two programs, IHSS and Medi-Cal, they reached the maximum of $100 per day. To bring down that $100 per day, we have to be timely every month. And every month that we're timely, it comes back down $2.50. So we work down back the ladder. This chart on page 9 shows you that assuming that we have all the resources we need, including for the new ACA workload, and it gives you where we are with the daily rate penalties for each of these programs. We will be, for example, within the $5 to $10 range, which is our goal, by June 2014 of this year. For CalWorks, June of 2015. For Medi-Cal, December of 2016, and for IHSS in March of 2017. So by March of 2017, if we can stay timely 95% or more for each month, we will then get back to $5 to $10 and then. So that backlog, that's how we define that. It's not like we can just, if we're timely this year, this month we're done with the backlog. It's going to take time to work it down, and that's why having the sustained resource to make sure that we have that capacity to meet calendar is critical.
So then this chart, the initial one that you showed us, was to indicate that you are going to have the workload to address the numbers of cases that are outstanding. But we're going to continue to have a problem with penalties accruing.
Yes.
As we try to catch up.
Yes. What this chart shows is that if we're able to maintain at this level, and if these projections are accurate in terms of where we think we're going to be with the workload, then that allocation is sufficient. There's two things that can happen.
And this is taking in consideration the additional positions that you're requesting?
No. This just gave you the picture for where we were
now. Right.
Yeah. This is just to give you the picture where we're at right now, and then if we get the additional request, then the chart on page 9 shows you how long it will take us to get to 5 to 10 in all program categories. If I may, there was two scenarios that can happen that can affect the penalties. One is if we get hit with a new workload as a result of a new program or of a change to an existing program. That historically has shown that we have an increase in workload. The second one is, of course, an assumption, and all of this is that we always have to, if our resources stay and we're able to sustain the resource, then we're able to assure that we can meet the workload as it arises. What we try to do is anticipate the workload and come and request resources so that we mitigate the penalties as much as possible. But if we get a workload late, which happens when there's litigation, which is the second scenario, litigation is much more difficult because it hits us and we usually have a backlog already. So those two events, either new program or program change by statute that's been enacted, or litigation, court orders, those are the two scenarios that can upset the assumptions.
Okay. I appreciate your overview. I just have to state I'm a little bit concerned. I appreciate that there has been progress. I understand your explanation with regard to furloughs, et cetera. But I am quite concerned at the amount and the total cost of the penalties that have been accrued over time. And those dollars, I think, could be much more well spent providing services. And I understand the challenges that you've had, but I just have to say I'm quite concerned about that. Is there someone here in the Department of Finance who could give us sort of an idea of what sort of penalties accrued over the last few years? And do we know what sort of penalties are going to be accruing under this scenario that you've laid out for us? Because I think we want to really be on top of this. And like I said, I understand that you had some resource issues over the last few years. But I think we really need to get a handle on this, because this is a lot of money that would be more well spent in services.
Well, I can address with respect to both. There was growth, but in two programs in particular, IHSS, there was changes to that. One was a 3.6% reduction. That resulted in a spike, even though as enacted, there was not appealable, the reduction itself, but the issues that are associated with requests for reassessment to determine after the reduction made whether the right allocation of hours have been made, they trigger issues. And so that results, that's the kind of example when there's a change to a program that results in an increase. The other one has been Medi-Cal. And in Medi-Cal, that we experience, that generally is around 32-35% of our workload. And as you look at the pie chart, it's 49%. So it was a 15% increase as a result of some of the changes or transition that happened from fee-for-service to managed care. There was increased appeals that resulted from that. And then there was the CBAS kind of scenario where there was a elimination of a program, and then that went to court, and as a result of the court order, there was appeals that were triggered, which those were late from day one. Since that was a scenario which is unique, our assumptions took the CBAS, and we noted that in our footnoting, that we took that out of the scenario because that would have really skewed, we think, the estimates. So we do stay very we monitor on a monthly basis the intake that's coming in. If we see a spike, we investigate with program and with the counties what may be causing something that otherwise isn't explained. We try to stay on top of that, and as soon as we think that there's something that we need to alert our fiscal folks, we do, so we can start those wheels moving as soon as possible. With respect to the new allocation, that is a moving target. So that, I mean, we're asking for limited term positions because we don't know yet where the dust is going to fall in terms of what is it ultimately that the Covered California, for example, appeals will look like. We think we have a better handle on the Magi because we've had the Medi-Cal experience from before. But that is why those are limited term positions, and we'll have a better sense a year from now in terms of after we've seen the process evolve, what that workload really may look like.
Yes, and I do understand there's been challenges, but I'd still like to know what sort of penalties have we been paying? How much in penalties have we accrued? And what are we looking at in the near term under the formula in your attempt to address the growth in hearings based on ACA and also dealing with the ongoing issues to address the ongoing penalties that we are part of?
Thank you, Madam Chair. Chris Cook, Department of Finance. Over the past year, penalties have rose from $251 million in 2008 to approximately $5.1 million in 2013. 251,000 to 5.1 million in 12-13.
And do we have any projection as to how we're going to address that going forward, and what sort of penalties we're looking at under the formula we just laid out here?
Brendan Nunes with Finance, and since basically we're at a point now where the department's addressing the backlog and we're at that 95% compliance rate, we should see, well, it brought us that, over time it brought us to that penalty amount where it rose to the level that it is per case. It's going to take us that same amount of time over the months being 95% compliant to step us down. So it will take time for us to bring those penalties down. But because we've kind of met that compliance rate, we should see those penalties start to decline from that peak of the 5.1 million, provided, as the department mentioned, there's no additional changes to programs. The ACA caseload that we're requesting here is approved, because that will be a significant amount of caseload on the department that they'll need in order to maintain that 95% compliance. So should they stay resourced and should we continue to meet that 95% compliance, those penalties should decline from this spike.
Okay. And I do understand that's what this request is all about, trying to get out ahead of the caseload and bring those penalties down. It is still, I mean, we must all agree the numbers are a little disturbing. So thank you very much. I think Senator Monning also has a question.
Thank you, Madam Chair. Well, I want to start by thanking Mr. Romero and all your staff for apparently catching up to the backlog with last year's allocation. And I realize from your presentation today there's not total exactitude in projecting how caseload figures may be affected. In the chart on page 7, all of the kind of increased workload seems to be anticipated with ACA, covered California, Magi, but the other categories seem to be referenced at an ongoing threshold. And I guess, I mean, you pointed to this, but my concern with the uncertainty of IHSS funding and the overtime issue that's outstanding, what's your confidence in sticking to this caseload on IHSS when we have the unknown of potential huge disruption of that program?
Perhaps I could take a shot at that, Senator Monning. As we sort of move forward with the administration's proposal in the budget process, part of how we're going to have to craft it is to make sure that it is not a reduction in services authorized for participants. That's what's appealable. If it is simply a limitation on what the provider can occasion, an individual provider, that's not appealable. That's not a fair hearing situation.
Right.
So we need to just be very careful as we move it forward that we're crafting it so that in each instance we have ensured that a provider, that a recipient of service is continuing to be authorized the number of hours that flow from the assessment, right. And that is not in any way tampered with.
Right, and that's clearly the objective, is to not disrupt the services. But I think some of the questions or concerns that have been raised by providers and recipients is that if we do eliminate provider reimbursement over 40 hours a week, are there going to be sufficient providers available part-time to bridge those gaps, which, if not, result in the recipient not getting the support they need, which I understand would be an appealable
and that's the proposal has to successfully address that.
Right. And again, I know it's hard to forecast. Our objective is clearly not to disrupt recipient services. I'm just wondering if it wouldn't be more prudent in the projections and the potential allocation for positions to inflate some of those anticipated hearings even by a factor of 10% or something. In other words, the equation that we develop of trying to avoid backlog and penalties, is there part of that equation that this BCP proposal, if it were larger, would hedge against, if we invested more in this BCP, would we hedge against the prospect of falling again into an increased penalty situation?
I take the point, Senator.
Yeah.
We'll pursue that.
Good, thank you.
Yeah. Would hardly agree with that. All right. Thank you very much. Do you have anything else to present on those items? All
That's
right.
it.
Thank you very much.
Thank you.
Yes. Department of Finance, any other comments? Legislative Analyst?
Good morning, Madam Chair and Senator Monning. I'm Lourdes Morales with the Legislative Analyst Office. Our recommendation is to approve this proposal as it better positions the division to provide timely due process as well as reduce its penalty exposure. Our recommendation is based on a few findings. One, that the caseload projection growth is reasonable and that this additional workload cannot be absorbed given current resources, as well as noting the existing challenges with the IT system. Thank you.
Can I ask you the same question I just asked them? Do you think the forecast is reasonable with caseload maintenance?
Our evaluation of the caseload pertained to the ACA-related growth. We did not do an evaluation of the existing jurisdiction.
Thank you.
All right. Thank you very much. Public comment?